Alright, so we're doing a little Monroe piercing removal. If you look down over here, this is a piercing that was done years ago. She wanted it removed, and so we're doing it. We use a punch biopsy, which if you look is a little circular knife, and we mark this beforehand, and you want to actually make the size of the punch go all the way around the piercing. If it goes into the internal rim of it where it indents, you end up getting an indent later. So it's better not to try to skimp on the size of it. So we core it down just a little bit to get around the tract. As soon as we do that, we release. We grab the Monroe piercing scar with a forceps, but you can never hold it right, so you grab it with a stitch as a hook, and you use your stitch as a retractor. So you grab the stitch, you pull it up, and you see the tract there. And now we just kind of snip around it. You're just going to feel very minor discomfort of pulling and tugging. And you just try to keep your head still. You doing okay?
Mm-hmm.
Okay, good. And the ones that are deeper, you have to follow them all the way through to the other side. These are the deeper ones, so you just follow it through. It's not a big deal. And you always keep snipping onto the tract so you don't make a bigger hole, which is not necessary. So these are pseudoepithelialized tracts, meaning they have a nice thick outer and inner layer. You can see it coming out. Anytime you do anything on the skin, you have to kind of understand the three-dimensional nature of it to treat it properly. Alright, so we're almost out. We're getting through to the inner side of the lip, which if we get all the way through, you can either leave it open or closed. It's kind of up to you. So there you go. That's the inside of the lip that we pulled out. Perfect, it's done. So this is your Monroe piercing if you want to see what it looks like. You like this? Cute little guy. Alright, so that's done. Now, the key to good healing of scars is to take off tension. So we don't just close it by itself. What we do is release the skin around it. So we set up our stitch, ready to go. Put your chin up. Thank you. So what we do is we release the skin in whatever direction we want it to close in. Because it's on the upper lip, typically you want to go vertical. And if you move everything else, you see it's vertical closure. So we're going to release the skin that way. We're going to release the skin that way. That allows you to advance it with no tension. To close it, no problem. Usually you can throw a deep stitch in, but this is a 3mm punch, so it's kind of hard. You have to use usually a 4mm punch. And this is a vertical mattress stitch, so at least you get some kind of tissue eversion. And you just throw the stitch right through like that. Now you have your vertical mattress, which everts the skin and bunches it up. If you don't do a vertical mattress stitch, you get inversion of these scars. And I would want to throw a deep one, but it's a 3mm. And again, 3mm, you're going to sit there for like 20 minutes trying to get a deep stitch in. It's very hard to do. 4mm, you can get it in. So that's it. That's your closure. If we want to make it perfect, we'll add a couple more. It turns it into a little straight line rather than a circle, which is good. There you go, and you're not having any pain, right?
Mm-mm.
Best time of your life, right?
Mm-hmm.
Yay! It's like Disneyland.
That's not fun.
Disneyland is no fun?
No.
The kids.
It's too much work for me. They like it.
Gotta manage them. Do you have leashes for the kids?
I should. I don't.
I'm gonna get, if I have like kids, I'm gonna get them shock collars, and then like they won't be able to go very far. It'll just be a very light shock, or maybe it'll just play bad music.
Mm-hmm.
And they'll be like, oh my god, I hate this song. And they'll come running back, Daddy, turn it off. Alright, fantastic. So that's it. We are done. It is all closed. This is what it's supposed to look like in the end. 3 little whiskers, and it's supposed to be bunched up just like that. If it's not bunched up, then it's not going to heal well. Bye.